right, welcome back to COVID Corner. So our next question relates to personal protective equipment, or PPE. So in an outpatient setting, what is the best PPE for the clinician and the patient to be wearing?
First, we'll kind of talk about what each mask is used for, and then we'll discuss the appropriate PPE for outpatient. All right. So first and foremost, we have something called droplet precautions. Droplet precautions protect you from large particle transmissions. So things like when people sneeze, cough, talk, when you're suctioning a patient, those are droplets. So examples of droplets, or somebody that would be on droplet precautions, is if somebody has the flu, meningitis, or pneumonia. For droplet precautions, we typically will just wear a normal surgical mask. So you've seen a lot of people wearing these in the hospital, out in the public, things like that. Our next type of precaution is called airborne precaution, and that protects against small particles that are transmitted through the air. So patients on airborne precautions are normally placed in a negative pressure room to prevent the spread of the disease that they have. With airborne precautions, you have to wear a special mask called a NIOSH 95 mask or an N95 mask. You actually have to be fit tested for this mask to make sure that you can't taste the sucrose when you have it on, just to make sure particles can't get to you. Examples of airborne precautions you would use on a patient that has chickenpox, tuberculosis, or the measles. There's a couple different types of N95 mask. This is a pretty common one you'll see. And then there's also one that looks like a duckbill. So they're just different manufacturers of these masks. And these masks are all from demonstrations when I taught a PPE class. I am not holding masks.
To the coronavirus, is it spread via droplet or airborne? Or do we know?
That's a great question. I haven't seen any data to prove one way or another. And we're seeing recommendations saying you can wear a surgical mask or you can wear an N95 mask. What do you think, John?
Well, I think the safest bet, if we don't know, is the N95 if you have that. And certainly, in the community, when I went grocery shopping yesterday at Costco, and I think they must have distributed the surgical masks to all of the staff at Costco, because they were all wearing the surgical mask. So I think in a public setting, to kind of be safe, the surgical mask kind of makes sense. If I were working with a patient that was diagnosed with COVID-19, I'd feel a lot safer, kind of wearing an N95 mask. And again, you make a good point in that it does need to be ideally kind of fit tested. But the main thing is that, it shouldn't fit loose. There is kind of a bracket on there to make sure the N95 fits tight and snug.
Yeah, and you want to make sure that you're wearing both straps. I've seen a lot of people in the public market just wearing one strap instead of two. You want to make sure it fits properly. One last thing I want to talk about is how to properly don and doff your PPE. Because if you don't do this correctly, you can actually still get infected with this. So donning means to put on. So when you don your PPE, you want to put on your gown, followed by your mask, followed by goggles or a face shield, which you're seeing a lot of hospital employees wear. And then lastly, your gloves. When you doff your equipment or take it off, you want to do it in this order. You want to doff your gloves, your goggles or face shield, your gown, and then lastly, your mask.
I think another important point there is, in addition to the order, is, and with the mask, with the face shield in particular, once you've kind of gloved up, finally, you don't want to be touching your face.
Yeah.
And so I think the face shield, certainly it protects from kind of droplet precautions if somebody were to cough, or if you were suctioning a patient and, you kind of had droplets, it obviously protects you from that, but it also kind of keeps you from, your contaminated gloves from touching your face, which is, I think, one of the big benefits. So, once you put those gloves on, keep your hands away from your face. Again, if you have any questions, you can go to our website. So our next question comes from Anonymous. who asks, for those who are at home who may have symptoms of COVID-19, but are not severe enough to go to the emergency department, are there any techniques that they could be doing to find relief as far as coughing or breathing to help prevent the virus and symptoms from worsening?
That's a really good question, because a lot of people who might have this don't want to go to the emergency room. The test for COVID-19 looks extremely painful, sticking the swab all the way up in your nose. But I think there are a couple techniques you could do at home. We touched on this in another video, but just posture, sitting upright, being prone, just changing position is going to be good for your lungs to make sure they're expanding, that sort of thing. What do you think, John?
Staying out of bed as much as possible.
Yeah.
You know, being, like you said, staying active, you know, getting outside, getting some fresh air, going for a short walk if, you know, as your symptoms allow, you know, doing deep breathing, puffing, like we mentioned in a kind of a previous episode, you know, and if you are feeling sick, you know, and you live with others, then especially kind of doing deep breathing, huffing, you know, doing those away from your family members or other folks that that you live with, you know, kind of self-quarantining in part of the house. Again, if you live with others and you're having symptoms, is going to be important to protect them.
Yeah, and you can also keep track and monitor how difficult it is for you to do activities. You can use something like a dyspnea scale to kind of rate your shortness of breath, an RPE, a rate of perceived exertion scale, to see how difficult activities were for you. And then you can modify from there. So if going up and down the stairs, you can't breathe at all when you get to the top of the stairs, I probably wouldn't be doing that at home. Maybe only climb 1 or 2 stairs and call it a day from there.
And for most folks, you know, that'll be kind of the extent. But you know, if your symptoms are progressing and getting worse, this disease, it does seem like progresses relatively rapidly. You know, so if you're noticing kind of a progression of symptoms, and you know what you could do, you know, this morning, in the afternoon you're having more trouble with, and now you're kind of severely short of breath, then that's the time to kind of to get to the ED, because again, this disease kind of can progress pretty quickly, and can kind of put people into respiratory failure where they do need the services of an intensive care unit, perhaps.